A little while ago, I came across a case that I genuinely never thought could even exist. It was about a 22-year-old girl who had never been in a physical relationship with anyone, and yes, I'm telling you this for a reason. You will understand why in a moment. One day, she suddenly started feeling an unusual bloating in her stomach. At first, she thought it was just gas or indigestion, but instead of getting better, the bloating kept increasing. Within just a few months, her stomach had become so swollen that anyone who looked at her would immediately assume she was pregnant. Now, just think about it for a second. How could a girl who had never been physically intimate with anyone possibly be pregnant? She herself was terrified, and her parents were terrified too. In fact, they had even started doubting her, thinking that she must be lying. Eventually, they went to a doctor who advised them to get scans and an ultrasound done. But when the reports came back, they left not only the family but even the doctors completely stunned. Inside her ovary was a strange lump growing, one that would horrify anyone who saw it. The lump contained actual human hair, fully formed teeth, and even traces of eye structures and brain tissue. It almost looked as if a tiny, incomplete human body was growing inside her, except it had no face. Honestly, when I first heard about this case, I literally paused in complete disbelief and disgust. My first thought was, is this some kind of horror movie? But this wasn't fiction at all. It was actually a type of tumor known in science as teratoma. And honestly, even its name perfectly matches what its condition looked like. The word teratoma comes from two Greek words, teras and oma. In Greek, teras means monster or something strange and frightening to look at, while oma is a medical term that means tumor or mass. Put them together and the little meaning becomes monster tumor. And honestly, I think that's the perfect name for it. Just imagine a disgusting looking lump with no proper arms or legs but with human hair growing out of it, teeth developing inside it, skin covering parts of it, and in some rare cases, even eye like structures. But this raises the biggest question. How does something so bizarre and disturbing even form inside the human body? To understand that, we first need to go back to the most basic stage of human development, something called the three germ layers. When a baby first begins developing inside its mother's womb, three special layers are formed. The first is the ectoderm, which later develops into the baby's skin, hair, and the outer layer of the teeth, and the brain. The second is the mesoderm, which forms our bones, muscles, blood cells, and heart. The third is the endoderm, which develops into our internal organs like stomach, lungs, and intestines. In other words, every single part of our body is ultimately built from these layers. Now, the special cells responsible for creating all these tissues are called germ cells, and they normally exist inside our ovaries and testicles, where their main job is to produce eggs and sperm. These germ cells only become active during reproduction, but a teratoma forms when a biological glitch or genetic mistake occurs inside one of these germ cells. Normally, when an egg and sperm combine, the DNA carries a complete set of instructions that tells every cell exactly what it should become. But if those instructions become damaged, the cell stops receiving the correct blueprint. Without any pregnancy, without a fertilized egg, and without any proper order, the instructions from all three germ layers start getting executed at the same place, causing hair, teeth, fat, muscles, skin, and other tissues to grow together inside a single tumor. Now, after hearing all this, I'm sure many of you are wondering, what if this happens to me? Honestly, that was my first thought too. Fortunately, this condition is quite rare, affecting roughly 1 in every 20,000 people. However, it is much more common in females than in males. In fact, around 10 to 20% of ovarian tumors are teratomas. Overall, doctors classify teratomas into three main types depending on where they develop and how they behave. Let's begin with the most common scenario, which is mostly seen in women. It's called a mature cystic teratoma, also known as a dermoid cyst. It usually develops in the ovaries of young women between the ages of 20 and 40. The good news is that around 98% of these tumors are benign. meaning they are non cancerous. But that certainly doesn't mean they are harmless. These tumors often contain fully developed hair, teeth, skin, and fatty tissue, and as they slowly increase in size, they begin squeezing the surrounding organs, increasing the risk of a condition called ovarian torsion. As the tumor becomes heavier, the ovary can literally twist around itself like a rope. This suddenly cuts off its blood supply, causing severe abdominal pain so intense that the patient often requires emergency surgery immediately. Now, that's the non cancerous form. But can teratomas also become cancerous? Yes, and that's where the second type comes in, known as the immature teratoma. This type is much rarer, accounting for only 1% to 3% of all teratomas. The key difference is that the tissues inside it haven't fully developed. Instead, they resemble the immature tissues found in an unborn baby during the earliest stages of a development. Because of this, the tumor can become cancerous. It's almost like a building whose construction was abandoned halfway, it becomes unstable. Interestingly, teratomas are even more dangerous in adult males. When they develop inside the testicle, the chances of them being cancerous are significantly higher than in women. That's why any unusual lump or swelling around the testicle should never be ignored. The third type is called an extragonadal teratoma, which simply means a teratoma that develops outside the reproductive organs. In newborn babies, these tumors most commonly appear near the tailbone, where they are called sacrococcygeal teratomas. But there's one more thing that teratomas can do, something that can literally affect the brain. And I don't mean that metaphorically, I mean it actually attacks the brain. In some extremely rare cases, ovarian teratomas develop brain tissue inside them. When that happens, the immune system mistakes those brain cells for dangerous foreign tissue and creates antibodies to destroy them. The problem is that those same antibodies become confused and start attacking the patient's actual brain as well. As a result, patients may begin experiencing hallucinations, memory loss, seizures, personality changes, and sometimes even violent behavior. Centuries ago, before modern medicine understood these conditions, people often believed such patients were possessed by evil spirits or demons. Finally, the most important question: can this tumor be treated and can it be prevented? Unfortunately, like many other tumors, teratomas cannot currently be prevented because they are not caused by poor lifestyle choices or unhealthy eating habits. They happen because of random biological or genetic errors. The good news, however, is that they are highly treatable. The primary treatment is surgery. If the tumor is benign, such as a dermoid cyst, surgeons can usually remove it completely, and in the vast majority of cases, it never returns. If it's an immature teratoma, surgery is usually followed by surgery and chemotherapy. Even newborn babies born with teratomas near the tailbone can often be successfully treated with surgery soon after birth and go on to live completely normal lives. And even in those rare cases where the tumor triggers an immune attack on the brain, removing the tumor often stops the immune response. So that's it for today's video. I hope this helped you understand one of the strangest tumors in medical science, because personally I learned a lot while researching it, and hope you did too. If you enjoyed this video, don't forget to like, share and subscribe our channel. I will see you in the next one. Until then, stay strong, stay safe and keep watching Instant Medical.